can ask the committee to come to attention. We're on our second panel. Can I welcome our guests, and can I ask you to introduce yourselves, starting from my left, please?
Yes, I'm Rachel Huxley, Director of Knowledge and Learning at C40 Cities.
I'm Daniel Black, Independent Research Coordinator, Daniel Black and Associates.
I'm Paula Hamilton, Cllr Hamilton from Birmingham in a ward called Ollie Head, and I'm also the Cabinet Member for Adult Social Care and Health.
And I'm Laurie Robertson, I'm the Head of Strategic Planning at BuroHappold.
You're all very welcome. Alex.
So we know that urbanisation has caused both mental and physical health issues for communities. What types of health outcomes do you think should be considered when we're developing new urban developments? Let's take on first. Laurie?
Our upstream project used economic valuation to get a sense of the scale of different health challenges. And noise actually came out as a very significant issue, but also green space, air pollution, indoor air pollution. But I should underline that the evidence, whilst there's a lot of evidence from the literature review that we did, the amount of evidence that you can take forward to economic valuation is very imbalanced. So there's a lot of data on air pollution, for example, that you can put a cost to, but there's very little on overheating, for example. So there's a range of different evidence available.
Yeah, there's been enormous surge in problems with mental health amongst teenagers in particular, and a lot of that has now been linked to air pollution, and much stronger links than with physical abuse, for example. And there's an issue about riding bikes in terms of people being unsafe and actually getting polluted. So, I mean, would people agree that we need to take a much more aggressive approach to literally restricting cars to facilitate safe riding? I know when I lived in Croydon, I did some cycling around, and you just feel paranoid. There's huge amounts of traffic and fumes, and it's just like, you know, this
And policies, sorry.
Thank you. So yes, unequivocally, there is a tension between economic growth drivers and also political pressures, which obviously you need to be mindful about. But the case of Stockholm is a good example, where they had 42% support for the congestion charge. They decided to do a 6-month trial, and after the trial there was 52% support, and there was a political leadership that wanted to see it go ahead, and so they made it permanent, and now it's up at 70% support. So having that political chutzpah, for whatever want of a better word, is obviously important, but also using trials as a way of just testing public opinion and demonstrating that maybe it's not quite as scary as people might think it is. There are also issues of inequality. I live in the centre of Bristol, and I can cycle around very easily, whereas people commuting in from the outskirts may not be able to. So actually there's a very significant issue around inequality and congestion charging. So there's a broader question about how you can balance those books, both politically and in terms of income and all the rest of it. I also just wanted to bring up a point that was made earlier on the previous session about costs, because if you look at the systems level and you try and put costs to all this sort of stuff, then you get a completely different picture. There are costs, for example, on air pollution globally. The OECD countries would be willing to pay 1.12 trillion to combat air pollution. McKinsey & Co did a report on obesity. It was 47 billion a year just for the UK. There's been other reports about mental health, 77 billion. In our upstream project, we were looking. We didn't want to come up with an aggregated figure because there's a divergence of opinion as to what weight those sorts of figures are given. Some people think that that's what we need. Other people think that actually it's too uncertain and they don't have that much impact. So we brought it down to an individual basis. And indoor air quality, for example, £250 per person per year in lost productivity. Or lack of green space, £220 per person due to impact on mental health. And it's only by bringing together all this stuff, because it's all the wider co-benefits, that you can start to get a proper cost-benefit analysis, and that would apply to congestion charging and all the rest of it.
Thank you. Very quickly, Laurie.
So can we get those figures?
Yes.
I think
I think. That's where the Germans have gone, that's where I've gone. Alex.
Yeah, Daniel already started to talk about resources, and I want to address that, and policy as well. I just wonder, how well has central government identified and adapted to the contemporary health challenges of urbanisation? It's a big question.
In a couple of sentences.
I mean, I was just looking last night at how the government's implementing the SDGs, for example, and also thinking about the makeup of the cabinet. This is way beyond my pay grade, but it strikes me that there's not a lot going on. The SDGs, the implementation of SDGs, I would describe as woeful. I don't know if this is in terms of the what's listed on the website in terms of the initiatives to implement the SDGs is just inadequate. So, for example, in cities, it's looking at cultural diversity, and which is obviously incredibly important, but also economic growth, and that's about it. In terms of health, I really didn't see much. On the health, is it SDG 3 on the health side? There is increasingly a focus from from Department of Health on prevention, which is incredibly important, and I think that needs to be encouraged as much as possible. But also just interested in, at the cabinet level, a question for you. How if you have environment in DEFRA and you have health care in Department of Health, where does planetary health sit across the cabinet, and who's responsible for it?
I think it sits here, Chair.
Absolutely. That's why we're
Not
here.
in government.
Anna, 3 more questions for Anna.
Thanks, Chair. Just following on from some of those comments in response to Alex, what do you see then? You mentioned the private sector and the roles the private sector plays. What do you believe its role is in building livable and healthy cities for the future?
Deliver that in a competitive environment.
Does anyone else want to comment on that?
Yeah, I mean, the private sector is absolutely pivotal and critical, and it's utterly dominant currently in terms of the delivery of urban infrastructure. The local authority has very little capacity. It used to be that they had a lot more. I'm not saying either one is right or wrong and about how they should be taken forward, but again, looking at our upstream research project, the delivery agencies in this country, they're aware of these health issues. They acknowledge that health is not factored in. They support the use of valuation mechanisms to try and bring it in. And they've suggested a whole range of different opportunities for trying to feed in different assessment of those health outcomes into the wider system. There are also issues around which we know relatively little about. There's been a lot of research and a lot of work done on issues around engineering and planning and architecture, etc., and about how we design and shape the urban form. But actually we understand very little about those interests that control the development process and how those interests align with these planetary health objectives. So, for example, one of the examples that was given us in this research project was if you are speccing, as they say, if you're specifying the quality of the paving of a development, if you're no longer involved in that financially after 5 years, then you won't have any interest in whether or not it performs. So there are issues around short-termism around. So, for example, if the majority of developments in this country aren't incentivized to think longer term, then you're going to be limited. So that would be.
Okay, can I just answer, before anyone else comes in, just to ask a follow-up question in terms of working with government in partnership with government, and what do you think the challenges are there and the risks associated with trying to form that?
So yeah, I mean, the government's rolled back a lot of Green Deal, Zero Carbon, Sustainable Development Commission, etc. But there are lots of good things: devolution, local government borrowing cap being lifted, the Social Value Act, support for custom build, community land trust, etc. So there are lots of positives. In terms of tax breaks and subsidies, one of the things that came up in our project was around land value capture. There's been a lot of agitation around this recently. All bar one of our interviewees were supportive of it, but one said it would be dangerous to try and unpick that. So clearly this is a significant point of contention. But what's missing from this picture, again, forgive me for repeating myself, is that there's a real lack of understanding, because this is putting all the onus on local government, and local government has very limited resource, and there's a huge lack of understanding about the role of the private sector and how they can actually help us address this.
Okay, thank you.
Thank you very much. John.
Thanks, Chair. Yeah, I would echo what Alex said earlier about councils and local authorities being given responsibility but not the funding. And as a former councillor, I totally agree with what you do, because we were on the ground level, see what happens to people in their houses, etc., and having to deal with the consequences of poor housing, and the lack of probably long-term planning is crucial to everything that goes on. But if I could just, my simple question is to yourself, Laurie, do you think homes in urban areas are fit for purpose, and what challenges are posed to the health of residents by the current UK housing stock? And I appreciate what Anna said, and some areas of Scotland are improved.
Just a quick point on that. Again, something that came out of this really fascinating example. The government decided about 10 so years ago, I don't know the exact date, to bring out a policy called PPG3, which was to try and discourage out-of-town developments and encourage higher density in-town developments. But for the industry, it was an absolute disaster because it meant that they had to. There was a disconnect between those who were going to implement this new policy and the policy itself. So you ended up with bad quality development because our industry was not geared up to deliver that higher quality, higher density development. So having the policy aligned to the implementation is absolutely fundamental.
I'll finish with that.
Great, thank you. Karen.
Okay, so I've been saving myself for this. So it's a slight change of tack from the previous questions. We start with Paulette. I wanted to ask about food policy, and you did sort of touch on it a few times, talking about obesity being a problem and lack of... but I suppose the thing I'm particularly concerned about is how do we make sure that people in cities get healthy food? And I know Daniel's got a very strong Bristol connection, he'll be aware of that as well. So
for me, it's how you teach those families to try and encourage the children not to eat that food.
Yeah, definitely.
It's a really tricky one to try and fix, I think, but I just want to give an example in Bristol again. Southmead, the new super hospital, when you go into it, it's the same with the BRI, the Bristol Royal Infirmary, you're faced with, as you get into the hospital, Coke, Mars bars, all this, and the disconnect between us wanting to provide a healthy environment in an environment where it's all meant to be about health is incredible. And so if we can maybe use examples like this as part of the narrative and a part of the discussion, then maybe that's one way forward. The other thing I wanted to say was about the upstream project again. Whilst we found a lot of evidence to support issues around air pollution, for example, or green space, there was actually relatively little, even though there's a lot of evidence out there on food, there was very little that we could use to put a value on that. So that's a piece of work that needs to happen, because I think with a evaluation and evidence around that would help planners to be a bit more...
1 minute each from Rachel and Laurie, and then we're going to have to terminate, I'm afraid. So, final thoughts.